come to a really rare disease with an important need for improvement, soft tissue sarcoma. And I do have the pleasure to introduce Dr. Alessandro Gronchi from Milan in Italy about the, how's the trial called? It has no own name, the trial.
No, yeah.
Good.
Doesn't have an own name. So sarcoma is a rare disease. We are talking about 1% of all malignancies, but so it's rare. It is especially rare in the population at the age where normally cancer occurs, so in the 60s, in the 70s, while it's one of the commonest cancers in the young adult population and in the children. So it's a disease which has a lot of impacts in the emotion and in the life of the people who at the end develop it. Adjuvant chemotherapy, so chemotherapy given to prevent the risk of further relapse, to prevent the risk of dying after a patient is treated for his localized disease at the time of presentation, has been debated over the years. Its benefit is not uniformly accepted, and the reason why it's not uniformly accepted is because the largest studies on chemotherapy over the years were negative, while the smallest were positive. So a lot of debate in the literature about that. We Italians were the first to show a benefit in adjuvant chemotherapy in a small population of patients, but affected by a very high risk of disease relapse. So based on this study, which was carried out in the 90s, we later developed this regimen, which is a regimen employing conventional drugs, nothing new, nothing sexy in a way, but conventional drugs that were used at full doses, proving to be effective. We decided to compare these drugs, which were not perfect, but able to give some benefit, with an histology-tailored approach. Why so? Because soft tissue sarcoma are rare and also heterogeneous. So they are made up by different diseases. So we wanted to see if a conventional chemotherapy given to everybody, the same to everybody, independently of the histology subtype, was as good or worse as compared to giving an histology-tailored chemotherapy, specific drugs to the specific histology subtype. Where did we get this drug to compare the conventional chemotherapy with? We derived information from the metastatic setting where this drug, these specific drugs, had shown a selective activity in specific histology subtype. So we were able to select 5 regimens to compare the conventional chemotherapy with. And these 5 regimens we use in the 5 histology subtypes, which are the commonest histology subtype occurring in this disease. So altogether, this represents 80% of soft tissue sarcoma with higher risk of relapse. And what we saw, we recruited in 5 years 435 patients, 287 of which were randomized. You see that median age is younger as compared to the one you were looking before. Size tend to be big, so this tumor tend to be quite large. And we had 240 available patients, and so on. So we were able to complete the preoperative chemotherapy in almost 90% of the patients. So these are the results. Patients affected, surprisingly, patients affected by high risk of tissue sarcoma of the extremity and trunk wall, treated with conventional chemotherapy, had a Kaplan-Meier probability, a relapse survival probability at 4 years, higher as compared to those treated with histology-tailored chemotherapy. And this also translated into a survival benefit. So adjuvant chemotherapy, conventional adjuvant chemotherapy seems to work. This was highly statistically significant. So formally, this is a negative trial because it was designed to test a superiority of the histology-tailored chemotherapy over the conventional chemotherapy. But, however, the presence of this statistically significant and clinically relevant difference in relapse survival and overall survival at 3 years in favor of standard chemotherapy provides, for the first time, a strong and randomized evidence in support of its efficacy that is still, up to now, considered questionable. And this is a level 1C evidence, which will be accommodated in the future guidelines. So in a population of sarcomas selected by high risk of relapse, averaging 60 to 70%. So patients who have a 60 to 70% chance of dying for their disease in spite of the fact that they have been treated for their local disease. The use of this chemotherapy is able to increase relapse survival and overall survival by 20 and 10% respectively. Of course, we wait the final analysis when the follow-up is mature, but we believe that the current clinical practice guidelines and the future studies will have to accommodate this evidence in the future. Thank you.
Thank you, Alessandro. Okay.